Assalamu alaikum. In the end of the last lecture, we're talking about the surgical treatment of the oral cancer, and we said that factor influencing the choice of the surgical treatment of a primary tumor in the oral cavity, depending on the many factors, like the tumor factor, and we said that the size and the site and the proximity to the bone and other structure. In this lecture, we're starting with the other factor called patient factors regarding the age of the patient, general condition of the patient, if it is can withstand the operation, or the if it is in the advanced elderly stage, occupation of the patient, lifestyle, if it's smoking or drinking, all these factors affecting on the choice of the treatment, socio-economic consideration, and the previous treatment, if there is a recurrence or not. Other factor is important for the surgical treatment is the physician factor regarding the type of the surgery, radiotherapy, chemotherapy, all these modalities, nursing of the patient and rehabilitation services ممكن توفروها للمريض, dental treatment if he needs any dental treatment to avoid the complication of the radiotherapy or the post-operative or after the radical surgery. So dental or prosthetic and supporting surfaces for the patient, all these factors should be taken in consideration. For general information regarding the surgical excision of the oral cancer, they stated that the excision of a lesion or primary lesion should be include at least 1 centimeter of the adjacent normal tissue as a safe margin. هذا النظام تقريبا دائما بس طبعا مو بكل الحالات انه المريض الطبيب يقدر يجزم 100% انه هو شال 1 centimeter from the adjacent normal tissue. So it is a principle you have to include 1 centimeter of the adjacent tissue as a rule. In general, superficial lesion of the floor of the mouth, buccal mucosa, soft palate can be excised through a peroral approach, يعني intraorally. أكثر الأحيان superficial structure يمكن الوصول إليها through the preoral approach. Also, depending on the size of the tumor, like the T1 and T2, extending from 2 millimeter to 4 millimeter, and the anterior part or anterior 2/3 of the tongue, where the mobility of the tongue is not restricted, the tumor not extending to involve the adjacent structure. All these condition or staging can be treated by what we call partial closectomy, also peroral approach. إذا تشوفون الستيج والclinical evaluation is very important, وكلها ترجع إلى judgment of the clinician. For access management of the oral cancer, access to the oral cavity can be done from many areas and many surgical rules. So the main surgical approaches for the oral cavity may be transoral or اسمه peroral, like mandibulotomy, واكو تكنيك ثاني هو يسموه lower cheek flap approach او يسموه visor flap approach و upper cheek flap approach. اذا يمكن peroral transoral هي المانديبولوتومي, lower cheek and upper cheek. For peroral or transoral, it can be safely used, safe procedure, especially for small anteriorly located and easily accessible tumor of the oral cavity يستخدمون peroral. بس إذا أصبح large disseminated يصبح peroral and effective. Also for the tumor which is small in the floor of the mouth, gum and cheek and the soft palate. This slide shows some of these surgical incision for peroral approach of the tumor, like this, starting from the anterior and go to posterior to the ramus, or a quadrant approach intraorally. This is for the mandible, and this is for the maxilla, starting from the maxillary tuberosity to the anterior nasal spine, exposing the whole maxilla. The other approach for the resection of the tumor, called lower cheek flap. In this flap, the incision is starting from the lip. If you look for these images, this is the outline of the incision. Midline lip splitting incision, and continued lateral to the neck for the exposure of the structure in the submandibular and the triangular of the necks for the dissection and the removal of the involved structure. This approach, this is the clinical image. This approach provides excellent exposure for a tumor of the oral cavity, especially when it is located in the posterior region. لأن accessibility مالته difficult، فلذلك تشوفون the huge exposure of the area. Mutilating surgery. هذا يسموه lower cheek flap. يعني انتم مطلوب من عندكم من صف خامس مجرد الهيد لاين اوف ان شاء الله اذا The other approach for the resection of the tumor called upper cheek flap, and this is the clinical picture for the upper cheek flap, and this is diagram to demonstrate the outline of the incision. And the upper cheek flap اللي يسموه فيرجسون، مشهور هذا التكنيك، ويبر فيرجسون، بس هم دائما يشوفين الجراحين يقولون فيرجسون incision. The upper cheek flap approach, ويبر فيرجسون incision and its modification. طبعا أكثر الأحيان الطرق الرئيسية يعملوها modification للجراحين. Is raised using a median إذا تطبعون على هاي الصورة، median upper lip splitting and carrying the incision around the nose with the corresponding mucosal incision بالداخل أيضا داخل الأورال cavity بالmucogingival buccal sulcus يعملون incision to expose the maxilla, specially used for larger tumor involving the hard palate for the resection of larger tumor, particularly when the tumor located posteriorly. إذن مطلوب من عندكم فقط الاسم والoutline of the incision and its indication for which type of tumor. The other important and famous approach for the resection of the tumor is called visor flap. أيضا مشهورة مثل الفرجسون flap. This type of flap, if you look for the image, this is the initial incision for the elevation of the flap, avoiding the lower lip, and this is the clinical image diagram for the clinical photo. So this flap provides sufficient exposure for the anterior located lesion, but not satisfactory for a tumor located in the posterior oral cavity. أكثر شيء يستخدموه للanterior located. One advantage of this flap or benefit is the avoid of the lower lip splitting for aesthetic. فمثل ما شفتوا بالفرجسون يسوون والupper cheek flap يسوون splitting، هنا ما يسوون splitting. To produce a permanent numbness of the chin because of the transection of the mental nerves on the two sides for adequate mobilization of the flap. في سبيل يرفعون الفلاب بصورة صحيحة to provide accessibility يسوون transectioning of the mental. So the patient complaining of sagging of the lower lip, sagging يعني ترهل, and the drooling of saliva due to the loss of the support and the sensation in the area due to the resection of the nerve. So the usefulness of this flap is limited, but it is a famous flap used by the oral maxillofacial surgery.